So now we're going to start the discussion about the heart tube formation. Okay. See, heart tube is formed in which mesoderm? Heart tube is formed in the splanchnopluric layer of lateral mesoderm. Please write the cardiogenic layer. Cardiogenic layer. I told you in the general embryology topic itself, heart tube formed in the splanchnopluric layer of lateral mesoderm. Splanchnopluric layer of lateral mesoderm. That is why the splanchnopluric layer of lateral mesoderm is called cardiogenic layer. Now, when the heartbeat will start? By 21st day, the heartbeat will start. Heartbeat start by 21st day. Now, when we can appreciate the cardiac activity? Cardiac activity is visible in the ultrasonogram by 6 to 7 weeks. Cardiac activity, it is visible in the ultrasonogram by 6 to 7 weeks. This is a basic idea. Yes, already we discussed this topic in the general embryology itself. So now, initially, the two endocardiac tubes are formed. See here, two tubes are formed. Now, these two tubes, they fuse and they form a single tube, single heart tube. Okay. So, initially, we have two endocardiac tubes. Two endocardiac tubes, they fuse and they form a heart tube. Okay. Now, this heart tube have various dilatations. They have many dilatations. So, now we draw the diagram with the dilatations. Okay. Now, this is the heart tube, the lower end of the heart tube. Now, the lower end, now this is our sinus venosus, the lower end, the venous end. And the sinus venosus, it is having two horns. Now, above the sinus venosus, we have primitive atrium. Now, above the primitive atrium, we have primitive ventricle. And above that, we have the bulbus cordus. Now, these are the various parts of the heart tube from below. Okay. Now, this is our sinus venosus. Sinus venosus, it is the venous end. Okay. Sinus venosus is the venous end. And then this is primitive atrium. And above that, primitive ventricle. And cranial part is the bulbus cordus. Is the bulbus cordus. Now, bulbus cordus is the artery end. So, artery end is above, the venous end is below. Okay, right. So, now we're going to start from the venous end. Okay, the venous end, I told you, it is called sinus venosus. Now, the sinus venosus having the parts. Now, this is the body of the sinus venosus. Two parts we have. This is the body of sinus venosus. And this is the horn of the sinus venosus. Okay. Now, we have two horns. This is the right horn of sinus venosus and this is the left horn of the sinus venosus. Now, each horn of the sinus venosus receive three set of embryonic veins. Three veins opening here. Now, this is our common cardinal vein. This is our vitelline vein. And this is our umbilical vein. So, three set of veins, they open into the each horn of the sinus venosus. Okay. So, now these veins are umbilical veins, common cardinal vein and the vitelline vein. Vitelline veins, umbilical vein and common cardinal vein. Common cardinal vein. Okay. So, each horn of the sinus venosus receives three set of veins. Now, these veins carry the blood from. We discuss in detail about these embryonic veins later in the development of veins topic. Okay, I don't want to dump everything here. So, we discuss the development of veins, from where these veins take the blood, what is the fate of these veins, how the portal vein is formed, superior vena cava, inferior vena cava formation, everything we discuss in the development of veins topic. So, now we have to remember only one thing. Each horn of the sinus venosus receive three set of embryonic veins. So, this right side, left side. So, right side umbilical vein, right side vitelline vein, right side common cardinal vein, they open into right horn of the sinus venosus. Similarly, left umbilical vein, left common cardinal vein, left vitelline vein, they open into left horn of sinus venosus. Clear? Right. Now, the left horn of sinus venosus regress. So the left horn of sinus venosus regress and it forms the coronary sinus. So please write, this part will regress. I am shading, no? So this part will regress. So by the side you can write, number 1, derivatives you're going to write, list out. So left horn of the sinus venosus regress and form coronary sinus. And form coronary sinus. Now coronary sinus carry venous blood from the heart. Very good. So if the left horn of sinus venosus is regressing, then what happened to these 3 veins? The cranial part of the embryonic veins also regress. Why, sir? The left horn is regressing. So the cranial part of left vitelline vein, left umbilical vein, left common caudinary vein, they also regress because the left horn is regressing, no? So in the bracket, you can write the cranial part of 3 embryonic veins, on the left side also regress. Is it clear? So left horn of sinus venosus regress and form the coronary sinus. This is very important. Okay. This is a question. Shall we proceed? Right. So now we have right horn and body. The right horn absorbed into body and they form smooth wall of right atrium. This right horn absorbed into body. So this entire thing, this right horn and the body, they form the smooth part of right atrium. This one, this entire thing. Okay. Shall we proceed? So right horn absorbed into body and they form smooth part of right atrium. So right horn of sinus venosus plus the body of sinus venosus, they form smooth part of right atrium. They form smooth part of right atrium. Okay, right. Next, now we have a gap. What gap, sir? Between the sinus venosus and the primitive atrium. That gap is called sinoatrial orifice. That gap is called sinoatrial orifice. Now in the primitive atrium, the primitive atrium, one septum is formed and thereby it divides the primitive atrium into right atrium and left atrium. So the primitive atrium, one partition is formed and that partition divides the primitive atrium into rough part of right atrium and left atrium. Okay. So please write the third derivative. The primitive atrium, it is partitioned and form the rough part of right atrium and left atrium. So now we know the development of right atrium. So right atrium is having 2 parts, the smooth part and the rough part. So smooth part of right atrium coming from right horn and the body of sinus venosus. The rough part of right atrium coming from primitive atrium. Clear? So if you want, you can put one box anywhere nearby and then write the development of right atrium. So right atrium, it is coming from, the smooth part is coming from, the smooth part of right atrium is coming from right horn and the body of the sinus venosus. Whereas rough part of right atrium is coming from primitive atrium. Clear? Fine. Now see the diagram. The diagram, we are seeing the sinoatrial orifice. Now the sinoatrial orifice absorbed into which atrium? The sinoatrial orifice absorbed into which atrium? Right atrium. So please write the sinoatrial orifice which is absorbed into right atrium. Please don't forget this. Okay? Right. Shall we proceed? Next, primitive ventricle. Just above the primitive atrium, we have primitive ventricle. This primitive ventricle forms trabeculated part of left ventricle alone. See, each ventricle is having two parts, the inflow part and the outflow part. The inflow part is called trabeculated part and the outflow part is called infundibular part. So if you want, you can write ventricles have two parts, inflow part and the outflow part. The inflow part means the ventricle receiving the blood from atrium, no? That part is called inflow part. Outflow part means the ventricle giving rise to arteries. Right ventricle, pulmonary artery, left ventricle, aorta. So blood is going in that direction, no? Artery. That is called outflow part of the ventricles. The inflow part of the ventricles will be rough. And that part is called trabeculated part. The outflow part of the ventricles will be smooth. And that part is called infundibular part. Okay. So each ventricle is having two parts. Number one, trabeculated part. Number two, infundibular part. Now the primitive ventricle is forming the trabeculated part of left ventricle alone. That is the point. So primitive ventricle, it forms trabeculated part of left ventricle. This is very important. Okay. Forms the trabeculated part of left ventricle. Very, very important. Not right and left, only left. The primitive ventricle is forming the trabeculated part of left ventricle alone. Next, bulbous cordis. Now, bulbous cordis, we're going to divide the bulbous cordis into proximal 1/3, middle 1/3, and distal 1/3. Now, this is proximal 1/3 of bulbous cordis. This is middle 1/3 of the bulbous cordis. And this is distal 1/3 of the bulbous cordis. Now, the proximal 1/3 of bulbous cordis is forming trabeculated part of right ventricle. Okay. So, trabeculated part of left ventricle is coming from primitive ventricle. The trabeculated part of right ventricle is coming from proximal 1/3 of bulbous cordis. Now, the middle 1/3 of bulbous cordis is called conus part. The middle 1/3 of bulbous cordis is called conus part. Now, the conus part is forming the infundibular part of both right ventricle and left ventricle. Okay. The conus part is forming the infundibular part. It is forming the infundibular part of both right ventricle and left ventricle. Right. Now, distal 1/3 forming the aorta and the pulmonary trunk. Forms the aorta and pulmonary trunk. Okay. Now, distal 1/3 of bulbous cordis, one septum is formed. What septum? Conotruncal septum. Conotruncal septum is formed in the distal 1/3 of the bulbous cordis. Okay. So, conotruncal septum formed in the bulbous cordis, which divide the distal 1/3 of bulbous cordis into aorta and the pulmonary trunk. Okay. Now, this conotruncal septum is coming from neural crustacles. The conotruncal septum, it is derived from neural crustacles. Okay. Now, this conotruncal septum is having two parts. Number one, spiral septum. Number two, bulbar septum. Now, spiral septum, which divide the truncus arteriosus, the distal 1/3 of the bulbous cordis is called truncus arteriosus. I forgot to say. Please write down. The distal 1/3 of bulbous cordis is called truncus arteriosus. So, the spiral septum divide the truncus arteriosus into two arteries. What are those? Aorta and pulmonary trunk. Okay. Now, what about the bulbar septum? Bulbar septum, which helps in the formation of interventricular septum, interventricular septum. Okay. So, bulbar septum we see that later, don't worry. So now these are the details you have to know about the spiral septum. See the diagram. Now the conotruncal septum having the spiral septum and the bulbar septum. Now the spiral septum divides the truncus arteriosus into aorta and pulmonary trunk. See, only because of the spiral septum, the blood from right ventricle going to the pulmonary trunk and the blood from left ventricle is going to aorta. Okay. So now we have some anomalies due to this spiral septum malformation. Sometimes the spiral septum displays more anteriorly. Anterior displacement of spiral septum. Anterior displacement of spiral septum. Spiral septum come more anteriorly. Now in that case, which in turn leads to pulmonary stenosis, number 1. Spiral septum displaced more anteriorly. Now because of that, yes, the pulmonary stenosis will be there. Because of pulmonary stenosis, the aortic opening receives the blood from both right ventricle and the left ventricle. So we see overriding of aorta. Number 2, overriding of aortic orifice. Overriding of aortic orifice. Number 3, because of this pulmonary stenosis, the baby will have enlarged right ventricular hypertrophy, which in turn leads to VSD, ventricular septal defect. So tetralogy of Fallot, these 4 features are called tetralogy of Fallot. Tetralogy of Fallot is due to the anterior displacement of spiral septum. Very old AIMS question. Very old means 2014-15 range. We got this question in the AIMS exam. So in the coming NEET exam or INCT exam, they can give you image-based question. They won't mark the features of the tetralogy of Fallot. Simply they will give the diagram. So the diagram you have to identify tetralogy of Fallot, and the question will be this given condition is due to anterior displacement of conotruncal septum. Okay, spiral septum. Next, I told you spiral septum. The septum course will be spiral in nature. Sometimes the spiral septum, they have non-spiral course. They formed straight. Okay. So non-spiral course of spiral septum. Non-spiral course of spiral septum. I told you, only because of this septum, the right ventricle giving the blood to pulmonary trunk, left ventricle giving the blood to aorta. Now here the course is non-spiral. Now in this case, the blood from right ventricle, see the diagram? So see the diagram? Because of this, the blood from right ventricle, it is given to aorta. Blood from left ventricle is given to pulmonary trunk. Okay. So this is called transposition of great vessels. So by this septum, the blood from right ventricle is given to aorta. Blood from left ventricle is given to pulmonary trunk. Okay. Right. Now this condition is called transposition of great vessels. So transposition of great vessels due to the non-spiral course of the conotruncal septum or spiral septum. Okay. Next, the spiral septum is not formed. Spiral septum is not formed. Okay. Why, sir? Because neural crystals, they fail to migrate. So non-migration of neural crystals, non-migration of neural crystals, neural crust cells, which in turn result in non-formation of spiral septum. Spiral septum is not formed. Non-formation of spiral septum. So spiral septum is not formed means then truncus arteriosus will persist. Okay. So which in turn result in persistence of truncus arteriosus. Truncus arteriosus. Okay. Right. These are 3 clinical anomalies you have to know in the spiral septum formation. Okay. That's all about the heart tube formation. Okay. So now heart tube, yes, the venous end is below and the artery end is above. Now from below, sinus venosus, primitive atrium, primitive ventricle, and the bulbous cordus. Bulbous cordus having proximal 1/3, middle 1/3, and distal 1/3. And we know the derivatives of all these parts. Okay. So that's all about the heart tube formation. Now we're going to discuss the formation of interatrial septum and interventricular septum. Okay. So now this is the common atrial chamber. So now this is our AV canal. Okay. That is AV canal. Now in the AV canal, AV cushion or endocardial cushion is formed. AV cushion or endocardial cushion is formed. Endocardial cushion is formed. Okay. Right. So now in the common atrial chamber, septum primum is formed. Okay. One septum is formed. That is our septum primum. That is our septum primum. So septum primum is formed in the common atrial chamber. Septum primum. Now for example, say this right side, say left side, say. Now between the right atrium and the left atrium, yes, the septum primum is formed. Okay. Now we have a gap between the septum primum and the AV cushion. Now this gap is called our ostium primum. That gap is called ostium primum. So ostium primum, it is a gap between septum primum and AV cushion. AV cushion or endocardial cushion. Okay. Shall we proceed? Yes. Now the septum primum grow and fuse with AV cushion. See, till birth we need shunt from right atrium to left atrium. Why? Because yes, only after birth the lungs will start the function. Only after birth the left atrium receive the blood from lungs through pulmonary veins. Okay, so till that, yes, left atrium receive the blood only from right atrium. Okay, so till birth we need shunt from right atrium to left atrium. So if you want you can write, otherwise leave it. So till birth we need shunt from right atrium to left atrium. Why? Because only after birth left atrium receive the blood from the lungs. Because only after birth lungs start the function, the left atrium receive blood from lungs through pulmonary veins. Okay, right. So now I told you the septum primum fuse with AV cushion will grow and fuse with the AV cushion. I told you we need shunt. So now there will be a break in the septum primum. Now through the break, now the right atrium communicates with the left atrium. We'll draw the diagram for that. This is the common atrial chamber and this is our AV cushion. Now the septum now fuse with the AV cushion. But immediately after this, there will be a break in the septum primum. So break means yes. So septum primum will break in the middle like this. This is septum primum. Septum primum break in the middle. Now we have a new gap. Now this gap is called ostium secundum. Ostium secundum. Okay, right. Now I told you we have the sinoatrial orifice open into the right atrium. So this is sinoatrial orifice which opens into right atrium. So this is sinoatrial orifice. Sinoatrial orifice opens into right atrium. Now which is guarded by two valves. Now this is right venous valve. This is left venous valve. So right venous valve. I'm writing RVV. Left VV, right venous valve and the left venous valve. Okay. Now right venous valve, left venous valve, they fuse and they form septum spurium. Septum spurium. Okay. So right venous valve, left venous valve, they fuse and they form septum spurium. Remember this. Now we have one more septum. What septum, sir? That septum is our septum secundum is formed. Now septum secundum will grow down up to the upper margin of septum primum like this. That is our septum secundum. So septum secundum is formed. Okay, that is our septum segundum. So that septum is formed, or new septum is formed. That septum is called septum segundum. Okay. Now, the septum segundum is a rigid valve. How it is getting the rigidness, sir? By fusing with right venous valve and septum spurium. So it is fusing with the right venous valve and the septum spurium, and the septum segundum become a rigid structure. So septum segundum, please write, fuse with left venous valve, fuse with left venous valve and septum spurium, and become a rigid structure. Now we have one new gap. We have a new gap between the septum primum and septum segundum. I'm talking about this gap. That gap is called foramen ovale. So foramen ovale is a gap between foramen ovale. It is a gap between septum primum and septum segundum. Okay, right. Now, what will happen after birth? So now blood from the right atrium go to foramen ovale, and via ostium segundum it come to left atrium. So the blood is flowing in this direction like this. The left atrium receive the blood from right atrium after passing through foramen ovale and the ostium segundum. Yes or no? This is number one. Number two. Number one is a gap between septum primum, septum segundum, foramen ovale. Number two is the ostium segundum. So if you want, you can write, otherwise leave it. Just for your understanding, I am writing. So blood from right atrium will come to foramen ovale. From foramen ovale, blood come to ostium segundum. Ostium segundum. From ostium segundum, the blood will come to left atrium. Is that clear? Now what will happen after birth? After birth, the left atrium receive the blood from lungs. Then the pressure inside left atrium will be high. Now because of that, now the septum primum will fuse with septum segundum and close the foramen ovale and create one partition between the left atrium and the right atrium. Okay. So now please write, after birth, the left atrium receive blood from lungs through pulmonary veins. So pressure in the left atrium will increase. So the septum primum fuse with septum segundum and close the foramen ovale. Close the foramen ovale. In 20% cases, now we have a gap. The gap between septum primum and septum segundum persist. Now this is called probe patency of foramen ovale. This is called probe patency of foramen ovale. And this is only anatomical, not functional. This is only anatomical, not functional. This is only anatomical presence, not a functional one. Okay, right. So this is about the interatrial septum formation. Okay, so by this closure, yes, we have one septum formed between left atrium and the right atrium. Now 2 more points. Now after birth, the septum primum, no. So after birth, the septum primum forms fossa ovalis. Okay, and septum segundum forms limbus fossa ovalis. Limbus fossa ovalis. Okay, these two structures you can see in the interior of the right atrium. I'll show you in the right atrium interior, don't worry. So please remember, the septum primum forming the fossa ovalis and septum segundum form the limbus fossa ovalis. That's all about the interatrial septum formation. So now next, we're going to see interventricular septum formation. Okay, right. Now see the diagram first. Now in the diagram, yes. Now this is our atrial chamber, the common atrial chamber, and this is the common ventricular chamber. Common ventricular chamber. See, the point is, Now the heart tubes formed like this, straight tube. No, first we have the venous end, primitive atrium, primitive ventricle, and bulbous cordus. The atrial end is below, and the ventricle end is above initially. But after the cardiac looping, the heart will form a loop. Okay, after the cardiac looping, the atrial end will go above, and it is behind the ventricles. The atrial end is here. This is ventricle end. Okay. Now after the cardiac looping, the atrial end go above and lies behind. The ventricle end is below and in front. Okay. The looping will be like this. Looping will be like this. So after the cardiac looping, the atrial end go above, is present above and behind the ventricle end. Above and behind the ventricle end. This is basic point. If you know this, there is more than enough. Okay. So now this is the common ventricular chamber, the common atrial chamber. So atrial chamber is above and behind the ventricular chamber. Is that fine? Right. Now next. Now this is the common ventricular chamber. Now, the common ventricular chamber is formed by the fusion of two structures. The common ventricular chamber is formed by the fusion of the primitive ventricle fused with the proximal one-third of bulbous cordus. Okay. So the common ventricular chamber is formed by the fusion of the primitive ventricle and the proximal one-third of bulbous cordus. So the primitive ventricle forms trabeculated part of left ventricle, and the proximal one-third of bulbous cordus forms the trabeculated part of right ventricle. Just now I told you. So these two parts, they fuse and they form a common ventricular chamber. Okay. So this is the common ventricular cavity. Now in the common ventricular cavity, from the floor, muscles will proliferate, and that is called the muscular part of interventricular septum. Muscular part of interventricular septum. So please write number 1, interventricular septum. Interventricular septum, number 1, muscular part is derived from the muscular proliferation from the floor of, muscles proliferate from the floor of common ventricular chamber. Number 2. Now I told you the conotruncal septum is having two parts. What are those? Above, spiral septum, below, bulbar septum. Now what the spiral septum will do? Spiral septum divide the truncus arteriosus into aorta and the pulmonary trunk. Yes. Below that we have bulbar septum. Now bulbar septum is helping in the formation of interventricular septum. Okay. So now number 2, the membranous part of interventricular septum is derived from A, bulbar septum. Bulbar septum. Okay, sir. But still, we see the gap between the bulbar septum and the muscular part. Now, this gap is filled by the tissue proliferation from AV cushion or endocardial cushion. So, the gap between bulbar septum and the muscular part is filled by the tissue proliferation from the AV cushion, and thereby complete the interventricular septum formation. So, membranous part is also coming from the tissue proliferation from AV cushion. Tissue proliferation from AV cushion. AV cushion I told you already, also known as endocardial cushion. Okay. So now the interventricular septum formation is complete. Interventricular septum is having two components, muscular part and the membranous part. Muscular part is coming from the muscle proliferation from the floor of common ventricular chamber. The membranous part is coming from two sources, bulbar septum and AV cushion or endocardial cushion, and thereby complete the interventricular septum formation. Is that clear? Right. So this is our interventricular septum formation. This is the muscular part, and these two will form the membranous part, and that is 2B, that is nothing but the proliferation from AV cushion. So this is 2A, that is the our bulbar septum. Okay. Yeah. And thereby, yes. completing the interventricular septum formation. That's all about the interventricular septum formation.